everyone, welcome to part 2 of the Big Conversation Speaker Series. I'm Sophie, the Marketing Manager at the Medway Innovation Institute, and I would like to thank you all for taking the time to join us for this fantastic webinar. I'm extremely excited for today's event. Here at Medway NHS Foundation Trust, we have recently launched the Medway Innovation Institute, our quality improvement accelerator. We have set up the Institute because we believe in our people who work at Medway and their capacity and capability to innovate for the care of our patients. I would like to take this opportunity to speak to you about 3 things on how you can get involved with the Innovation Institute. Firstly, I want to encourage our staff who have joined us here today to bring forward their innovative ideas for improving the hospital. There is no idea too big or too small. If it improves quality, we want to know about it. We have launched our new website, which allows you to submit your ideas. Through this platform, you will be assigned a quality improvement coach who will support and facilitate the delivery and implementation of your idea. Next, I implore you all to visit our website to find out more about different quality improvement training courses that we are offering to all of our staff from every level. If you're a member of staff at MFT, there is a training course available for you. And finally, I would like to thank all of our external innovative colleagues who have joined us today. It's great to see so many of you. I encourage you to get in contact to see how we can come together and collaborate to ensure we are improving our whole health economy as one. Everything we do at the Medway Innovation Institute is to improve health, making sure our patients are kept safe and receive the highest quality of care. By bringing the best minds together, we can achieve more, which is why I'm absolutely delighted to bring you some of the greatest minds in healthcare innovation for part 2 of the Medway Innovation Institute's Big Conversation Speaker Series. Thank you all again. I'm sure you'll find this event an incredible insight into the future of health. Now let me hand over to our guest host, Douglas.
Hello everybody there. Thank you very much for that introduction, and I really hope that all Medway staff will rise up to that call to action and get involved with the Innovation Institute. It is a fantastic development indeed. So first of all, I want to introduce the 3 speakers so that you get an idea of what their backgrounds and what they're going to deliver for this show. Like we said, these are 3 very, very influential, very, very prominent people in their own respected fields. So first of all, we have Neal Batra, who is a New York-based healthcare strategy partner at Deloitte, with over 17 years serving clients across healthcare ecosystems to help them address challenges related to digital transformation, growth, and innovation, and including business enterprise strategy. So Neal, how are you doing?
Yeah, I'm good. Great to be here.
Fantastic, fantastic. And next up to bat, we have Dr. Vinita Bala, who is a UK clinical leader for digital health at Deloitte. Vineta is trained in medicine and public health with 2 decades of senior level experience working in clinical and regulational services across the world. This includes serving as the Executive Director of Hospitals for the Singapore Ministry of Health and an advisor to the Department of Health and Director of the National Community Healthcare Services Development Programme for NHS England. Hi, Vineta, how are you doing? You okay?
I'm good, Douglas, and looking forward to the conversation today.
Brilliant, brilliant, brilliant. And last but not least, we have Catherine Skilton, who's also a partner at Deloitte's Health Strategy and Business Design team, bringing to the table more than 15 years experience in integrated care systems, development for mergers and acquisitions, financial and operational improvements, and post-merger transformation within the NHS and private healthcare sectors. Hi, Catherine.
Hi, Douglas. Really, really pleased to be here and supporting such an important local initiative. So thanks for inviting us.
Thank you very much. We are in that moment. So today's episode, as Sophie was alluding to, will focus on the future of health and what this means for healthcare consumers, namely patients. There will be an opportunity for you, the audience, to ask questions and get involved at the end of the webinar. Thank you all again for being here today. It's great to have you all. Over to you, Dr. Vineta.
Thank you, Douglas. It's a pleasure to be invited to the Medway Innovation Institute Speaker Series. So we're talking about Hospital of the Future today. And in the next half an hour or so, Catherine, Neal and I will share some of the innovations, both the traditional sustaining improvements and some disruptive ones that are changing healthcare across the world and also right here at home within our NHS. if there's one thing that we want you to take away from this conversation today, is as clinicians, managers, healthcare workers at all levels, please do not accept status quo as fait accompli. Do not accept to do just what we can do. We want you to challenge some of our traditional healthcare mental models and boundaries in how and where we deliver care, who delivers the care, and the role of those who are receiving this care. And there is no better time for doing that than right now. We've been talking about telehealth in the UK for over a decade now. We've been piloting new staffing models, and we've talked about organizing care around patients instead of buildings and organizations. However, dire necessity is the mother of innovation, and the COVID pandemic has really accelerated and embedded change in the way we deliver and organize care in NHS in an unprecedented way. Most of us who are working in the trusts have moved our outpatient consults to exclusively virtual visits as a default. We are providing advice and guidance to our GPs almost instantly. We are triaging our patients electronically, and amongst all of you, everybody's almost redesigned your clinical pathways and optimized theatres to make capacity more flexible. We've also managed to train staff from various functions to take on new roles very quickly. However, for all that we've done in the last 3 months, COVID pandemic is not going away in a hurry, and nor is the threat of the future pandemic happening again in a year or so. So it is a wake-up call for all of us to build flexible capacity and have a plan B for all our services to ensure continuity of care for our patients. More candidly speaking, one of my medical director colleagues shared with me just last week that most of his outpatient improvement plan for the next 3 years got delivered within a month of COVID. So in many ways, this is the best of times for those amongst us who are interested in transforming our NHS. You may have heard about Clayton Christensen, disruptive innovation, and basically it's based on the concept that innovation can come from outside, a non-traditional provider, a new startup, or even a big player from another industry that creates a new market and value network. This could even disrupt or displace established providers, including, in our case, the NHS. So does that even appear to be remotely relevant in our English public healthcare system with its principles of universal access and free amount of care? But I will ask you, isn't this already beginning to happen? Most of our electronic patient record systems will be hosted maybe on cloud-type services within the next 5 years. There are companies like Babylon Health, which are able to provide AI-supported instant GP consultations and specialist triage. Now within the NHS, we have a whole lot of our own apps, but they will soon be interacting and interfacing with patients' own wearables, whether it's an Apple Watch or a Fitbit. So we're doing a great job of better connecting care across different settings and redistributing specialist services than we were previously in the NHS. But what examples are there in the UK of fundamentally shifting the hospital's operating model? Catherine, may I invite you to share some of the innovations that you are seeing taking place in this space?
Of course, Vineta. I think you're right. I think we're doing a great job at integrating and digitising care and starting to shift some volumes away from the hospital. But I think I've seen very few examples of fundamental operating model shifts in the UK. And it'd be good to get Neal's perspective on the US later. So as Douglas said in the introductions, my day-to-day role involves leading a team that supports the NHS to deliver operational improvements. And through that exploit digital solutions. And through this work, I've had the really great privilege to see not only some of the solutions that our own teams at Deloitte are building, but also some of the fantastic innovation from within the NHS and from many of the health tech organisations that we partner with. And this is how I first came across an organisation called Medway. As you said, Vineta, necessity is the mother of invention, and that's very much been the case during this pandemic. With many of those tech solutions evolving and scaling more quickly than was originally planned to support the NHS to deliver care virtually, and more recently to restart electives and beginning to recover the backlog, which obviously is no small task. So Mediffer, which I understand actually that Medway may already be looking at, is a really great example of disruption. It's a fully virtual pathway for outpatients, and it's a CQC registered care provider in its own right. So a really great example of the first theme of operating model transformation in our recent Future of the Hospital point of view, which Neal will talk about later. Mediffer was born around 7 years ago, I think, out of the frustration of its consultant founders who saw an opportunity to manage the care of their patients differently. They felt that a significant cohort were often waiting for long periods for unnecessary physical first appointments. So not necessarily an unnecessary appointment in itself, in that advice and guidance or diagnostic testing was required, but they felt that there must be a better way of doing it. And over time, their solution has evolved from advice and guidance software to a fully managed service to offer outpatients in a virtual manner, including through a flexible virtual workforce. And it's achieving really impressive results. So I think on average, 60 to 70% of patients through the Mediffer pathway are discharged without the need for a physical outpatient appointment. There's been a significant reduction in the RTT pathway to an average of around 10 weeks versus the national target of 18. And the first referral to triage time is around 10 hours. So a huge impact. I should probably mention that I've got absolutely no financial interest in Mediffer Vineta. It's just a really exciting model, but I'll stop there and hand back over to you.
Thanks, Catherine. Triage within 10 hours of referral is impressive indeed by any standard. So let's talk a little bit more about data. In NHS, our HLE's heel has been the data quality and connectivity. What are your views on improving data? And also share a bit about all this new exciting stuff about AI in healthcare that we keep hearing about.
Yeah. So I guess I see this as a particular area of focus for the UK, actually, and one in which that we're very much playing at Deloitte. So data has, clearly been crucial during the pandemic and will be essential for predicting care volumes, matching capacity and demand and workforce to demand. And it's really going to underpin the delivery of efficient healthcare in the future. So as you mentioned, this does include artificial intelligence, but also other advanced analytical techniques, the development of digital twins, command centres, and the increasing use of robotics and alternative reality. So perhaps to bring this to life through some examples, so a couple of the things that we're working on at Deloitte are creating a digital twin of an emergency department, which is called ECHO. And this solution allows real-time testing of the pathway and resource changes within ED without impacting on ED performance, so within a virtual environment. And it's being used to both map staffing needs against rota and patient flow to reduce the need for temporary staffing and locums, but also sort of more strategically to support scenario planning for emergencies, including future pandemic staffing shortages. So future pandemic surges and staffing shortages. We've also built the first AI-based referral management solution, which is called Rita. And we've done that with the NHS in Scotland, so NHS Lothian. And that solution uses natural language processing to read the GP referral letters. And then it uses artificial intelligence AI to automatically triage to the appropriate pathway based on urgency and expected outcome. The solution then automatically books the required diagnostic or outpatient appointment and sends a letter back to the referring GP. And as well as reducing the triage time, this is also allowed for analysis of the variation in referral patterns between GPs, which has supported GP education. A final Deloitte example here, Vineta, is our well-developed artificial intelligence and natural language processing based theatre optimization methodology, ATOM. ATOM accurately predicts procedure times for individual patients and consultants in order to optimise time in theatres, so moving away from the traditional approach of averages. Before the pandemic, this generated an average of 10% additional operating activity across the 17 trusts where it's already been deployed. And now it's being used to support flexible theatre scheduling, factoring in infection prevention and control and emerging Royal College guidance. We're also partnering with the Trust to evolve it fully into a fully automated theatres booking solution. Of course, it's not just Deloitte that's working in this space. One of our partner organisations in this space is Touch Surgery, and they're the world's first AI-powered video storage and analytics platform for surgery. So an example of the alternative reality that I mentioned. So they use analytics and AI to assess and understand variation within surgical procedures to support training and improvement, which could very much complement the Atom solution.
Thanks, Catherine. And, I can't wait to see what clinical audits will look like with Touch Surgery. So we saw a lot of large and small scale improvement projects in NHS healthcare space, but not that much of total system transformation so far. Some countries have done that, partly such as Singapore and Sweden, but some have done a whole system change linked to specific themes such as digitization, for example. And Estonia, and I believe Israel is also a great example of this. But I'm often challenged by my NHS colleagues that these dramatically new operating models are usually easier when you're starting from a relatively clean slate, such as some of the emerging healthcare economies. However, it is much more complex than some of our more well-established healthcare systems. So, Neal, let me ask you this. What has your experience been in the US? Because like us, you would be one of those established and complex healthcare systems. Over to you, Neal.
I was on mute. I'm sorry. So yes, thank you for the question. Good question. So I'll comment about the U.S. here in a moment, but I also want to maybe speak more globally for a moment, which is you're seeing the changes that Catherine has referenced and Vineta, what you've referenced already, occurring around the globe. You're seeing it play out very differently. In some cases, you're seeing a top-down approach that's government-led or maybe private industry-led where you don't have a strong single payer. But in other instances, you have it coming from the bottom up, bubbling up within smaller enterprises, maybe smaller in scale initially, and sort of gaining steam and traction as it's demonstrating value. And so I guess one point I would make here is I don't think there's one right way to do this. I don't think there's one right way for a country to begin to evolve their approach. I don't think there's one right way, frankly, for an individual provider system to evolve their approach. What I would say is it's a function of the moment, the energy, frankly, the ambition of the clinicians and the enterprise itself. And I think there's lots of ways to get there. So let me sort of make that as a first comment. What's interesting is you heard from Catherine mentioning Medway and reference that it's actually been in place for about 8 years now, started in 2012. So some of the changes you're seeing have been in play now for some period of time. I can reference another example, a small system in the middle of the US called Mercy Health, and they've been in place since 2015, creating a connected dynamic where they're actually able to monitor patients in their home and send and push connected data to providers who are bedside to facilitate essentially remote care in a dynamic way that allows that patient to remain in their home. So that's a small system that's done it in a small way. We've had large brands like Johns Hopkins actually go down a very similar road at a much larger scale. And in that case, it's much more around a connected home, interoperability of data to the extent that's possible, and their ability to actually manage an admitted patient from a remote perspective. And it's less about providing information to the provider in the room, though that's what they do. And it's more around their ability to actually extend the walls of their hospital into the patient's home and create that, create essentially beds as part of their system through technology. So you've got a small system wading into this 5 years ago. You have a much larger system that's maybe gotten into it more recently. So you're seeing lots of energy, and those are catalytic moments, I think, for transformation in general.
Thanks, Neal. I mean, I guess as clinicians, we are always taught to look for evidence before adopting something into practice. And interestingly, you talked about Johns Hopkins, which has been at the forefront of evidence-based healthcare. So what has been the experience around building up appropriate evidence and aligning the regulatory environment with these innovative models?
Yeah, it's a terrific question in the sense that we as clinicians have always been taught, understand the regulatory environment, understanding the parameters, operate within those things, because the last thing we want to do is wade into gray areas or cross the line from a regulatory perspective. But what's interesting is given the technology that's in play, given the cultural changes on the consumer side that we're seeing everywhere, not just the US, not just Asia, but genuinely globally, Europe, South America as well. You're seeing an enormous moment of change. And so, the Deloitte practice is a large practice, world's largest healthcare advisor. We spend a lot of time with regulators as part of what we do. And so both through official sort of commentary that's public, as well as a lot of water cooler conversations I and my colleagues have had over the years, what I know from a regulatory perspective is that it's been a heavily regulated space for the last 50 years or so, and no regulator, no matter where they sit in the world, would say it's gone great. What they would say is it's been closely regulated, and what we've got are much higher costs and fairly middling returns for that cost. And so what we're finding is a lot of energy on the regulator side to do things differently. But what I think that means is enterprises need to show up and have a different conversation. And so what I've actually done with a handful of my clients is navigate them through a few of the regulatory bodies in the US to elevate their discussion and create some space for them to maybe try some experimental things, which on its face may look like it flies in the face of existing regulatory guidance. So that's a long way of saying, don't let the tail wag the dog here in this innovative moment. Yes, the regulatory environment absolutely matters. I, of course, am not suggesting you go out there and break rules. What I am saying is that there is a conversation to be had here with regulators, UK included, that if you have a creative approach to address care, deliver better outcomes, manage costs, create efficiency, be more data driven, I think your regulators are willing to sort of listen to that, and they may be willing to sort of sponsor and support a very non-traditional approach in terms of how to do that. So hopefully, Vineta, that sort of responds to this question of regulatory, which is, yes, it matters, of course, but there's opportunity to flex here if you speak with them and work with them.
Yeah, you're absolutely right. And in fact, some of the national agencies around the world are really waking up to this reality. I mean, for example, Singapore Department of Health has established a regulatory sandbox for their new innovations, where they work with the industry to identify what are the new innovations coming in, and anticipatory regulations are formulated with the industry and with the healthcare providers. And I think with the COVID, even in your backyard in the US, the FDA has significantly streamlined its regulatory approach towards drugs and therapeutics. So things are changing.
Yes.
Catherine, you talked about some of the exciting stuff happening in the operating models for the hospitals, future of big data, and the AI-based analytics in the UK. So the key premise of the healthcare services, especially the National Healthcare Service, is that of service to our patients. Any innovation that we do is only meaningful if it helps us improve patient access, experience, or outcomes, directly or indirectly. So I would like to hear more from you and then Neal as to what's happening in this space.
Thanks, Vineta. I mean, this is such an important point, isn't it? Healthcare in the past has been very much oriented, I think, around the way our workforce provides care. And while all of the innovative examples I've given so far will improve efficiency and indeed access, a key trend globally is putting control of care into the hands of the patient. And I think it's fair to say we're at fairly early stages of that in the UK, and it's going to require massive cultural shift and transformation. But on the technology side, a really good example is the likely evolution of patient portals. So I'm thinking of applications like Zesty, which in fact already includes integrated appointment management for self-booking and cancellation, the capability to view and share test records and test results and take control of your own data, support for chronic care management, and indeed a video consultation facility. I actually see this evolving into a truly integrated patient journey with navigation and guidance through the appointment journey. So how do you prepare and get to your appointment? Integration of discharge planning and logistics, so booking TTOs and travel arrangements, as well as post-discharge education and engagement. There are loads of other examples I could mention as well. So e-triage, for example, is a tablet-based emergency department triage system that is evolving into an appointment-only accident and emergency model. Or the use of voice technology is really interesting. So something like an Alexa at the bedside, which Deloitte in Australia has developed into a hospitality system that allows the smart routing of patients' requests to improve both patient experience and satisfaction and increase nursing efficiency. But I'll probably stop at that, because I could go on for a long time, because I think a really obvious challenge, and one that we should think about, is that there are so many of these solutions on the market, plethora of them, in fact, and the NHS really needs to navigate this and pick the best set of solutions, not just for what they can provide now, but for how they are evolving and how they fit together with other solutions and become greater than the sum of the parts. And this is one area where we are very much working with our technology partners and the NHS to enrich the technology. So, for example, by building artificial intelligence into the triage process, or to use the rich data set that these solutions provide to predict hospital patient flow and get the right patient to the right place at the right time as part of an overall command centre solution. I think, Neal, it would be great to get some of your US perspectives on this.
Yeah, you know, what's so interesting about, Catherine, what you just walked through are lots of choices sit in front of the provider and the hospital in terms of how to think about data and access in terms of information and the connectivity of it. What we're also seeing, and this is heavily driven in the US in part by the consumerism of the US patient at the moment, right? The energy the individual consumer has in the US market, in part because you know, you all know the sort of challenges in terms of health coverage and financing coverage in terms of healthcare in the US. You know, 2/3, so 67% of personal bankruptcies in the US are health related. So for the US health consumer, they are more than willing to try new models, in part because it is an economic necessity, because if they get sick at the wrong time, it could have dire, not just health consequences, but financial consequences. So what you're seeing is an enormous marketplace in the US around tools and apps and data connectivity at the consumer level, meaning in the consumer-owned tools. And so what you're seeing increasingly are consumers showing up in the physician's office, your GP or your primary care doc, and they're saying, hey, look at my Fitbit sleep data. Isn't this interesting that I started having very different sleep dynamics 2 weeks ago, and that reconciles with these other symptoms? You know, what do you think it is? And what's so fascinating about that is Deloitte's done a lot of work with doctors to sort of get their reaction to moments like that. And what we hear consistently is that basically 70 to 80% don't even consume the data the consumer or patient showing them. And part of that is driven by the fact that, one, the doc doesn't trust the data. They say, look, that's not a clinical, you know, sort of level of quality that I'm comfortable sort of reacting to. Two, they say, I've not been trained on that. I'm not even sure I know what I'm looking at. And three, they're like, frankly, who has the time? But the problem is that from a consumer perspective, that's a really unsatisfactory sort of experience. And so I think what we're increasingly seeing is going to be consumer-owned, consumer-generated data from the world around them through connected sensors and devices in their homes and in their work areas and in their cars. And they're going to show up at the physician's office or show up when they're engaging with a provider, and they're going to say, look at my data, help me process this and help me understand what this means. So I think the trick here, Catherine, to sort of react to your materials is, yes, the hospital needs to sort of figure out how they want to think about data and what they plug into officially. But I also think this falls to the providers and the clinicians themselves, which is how do you react to the consumer themselves walking in with one of 1,000 different apps or tools with a bunch of data on it, and you working with them to understand what that data means and helping them understand how to use it as a tool to sort of manage their health better. So it's got to, I think, happen from both sides, both from the provider side to figure out how to address data and access, but it's also going to happen on the consumer side, where they're going to be pushing, we think, increasingly more active. Now, again, that may be a US dynamic, and that may be an Asia dynamic before it's a single payer UK dynamic, but we do think that's going to come here at some point.
Yeah, just a quick revert, Neal. Actually, I think it might come to the UK sooner than you'd think. So speaking to Zesty, that is very much the next evolution that they're looking at within their patient portal. So how do they start to integrate some of that data from, for example, wearable devices? So it'll be really interesting to watch how they go with that and how they engage clinicians around some of the challenges that you've outlined.
Yeah, very good.
Absolutely. And, I guess, a lot of this innovation will be driven by our patients. And it's also interesting hearing you both. So how much of innovation space is technology, and not new technology, but more of adoption of technology into solving for healthcare. So you also both touched on the bewildering myriad of technology and the options available around each of the solutions. So we are all very mindful that innovation can't be just for innovation's sake. When we do tech business cases in the trust, we are often asked about benefits, both the more tangible monetary benefits as well as benefits in care outcomes and such. So, and another big question from the pairs is a time frame. That is, everybody, and everybody included, would want a quicker return on investment. So what is your view on that, especially when dealing with some very new and innovative solutions, which need quite a bit of time into embedding and also in showing benefits?
That question to me, Vineta?
Yes, Catherine. I apologize. It's to you.
No problem. So on time frame, first of all, I think my view on that is be agile, start small, fail fast, and then scale quickly. I think that's the only way to sort of deal with tech and innovation in the NHS, and it's how the private sector works. In terms of benefits, I think we've probably all got some war wounds around this. Past experience has often shown in the NHS that any new technology implementation without change management is unlikely to realise the benefits. And the sort of change that we're talking about does require concerted and coordinated management effort. And some of the work that you're doing in the Medway Institute will really support with that. So to bring it to life, just going back to my first example of Medifa, there are clearly immediate opportunities through this solution to reduce locum costs and clear the backlog, but also to reallocate capacity. So for example, if a consultant is delivering 60% less outpatient work, there's obviously an opportunity for them, if they're, for example, a surgeon, to do more surgery, or to provide more ward round cover potentially to improve bed productivity, etc. But delivering that, isn't simple. It's going to require change effort, such as the detailed redesign of processes, demand of capacity analysis to understand the full impact on the workforce, and flowing that through to things like team job planning. And that's going to need change effort, it's going to need resources, and that this is another area where our technology partners are looking to us at Deloitte for support. Back over to you, Vineta.
Thank you, and thank you for painting this amazing vision of the future of hospital and healthcare, both you, Catherine and Neal. So if we summarize, there is clear talent in NHS with this COVID and all the other things happening. I also feel that it's an exciting time, that it's a fantastic opportunity to transform services and reduce the burden on staff while improving patient experiences, and which should in any case be an overriding for all us innovators. So before we move on and let Doug, Douglas ask us questions from the audience, Neal, let me invite you for some final inspirational thoughts.
Sure. So, what I would say about this moment is that change is everywhere right now. Globally, you're seeing enormous transformation in terms of how healthcare plays out. That is driven in large part by technology, but is also driven in large part by culture and the notion that there has to be a better way, and let's continue to work towards that. So what I would say, and I think this is what the Medway Innovation Institute is really meant to do, which is to serve as a catalytic sort of vehicle to get things moving. And what I would say for each of the clinicians who are listening in today, if you feel like your job and the role and the way you're doing your things is sort of the same as it's always been, and it looks like it's planned to be the same going forward, I would say raise your hand and get creative in terms of looking and seeing what others are doing, and maybe begin to push the trust forward here in terms of embracing the technology and the data and the consumer centricity that we think is driving a lot of the sort of new ways of working and frankly better outcomes all around the world. So we think this is an unbelievably exciting moment. It's an opportunity for change agents to sort of embrace that. And then it's also a bit of a warning to folks who are saying, if I'm looking to have the same job I've always had and do it the way I've always done it, this will be an increasingly challenging time for you, because I just don't think that's sustainable going forward. And so, wish you all tremendous luck. We think it's an enormous opportunity, lots of really creative ideas out there. And so really there's an opportunity to have some genuine impact, which I know we all want to have. So, with that said, I'll make two other comments. One is we're going to follow up this conversation with some materials from the Deloitte side around the future of the hospital. So we welcome you to sort of take a look at those and obviously reach out to us with any questions. And if you're more interested actually in the broader conversation, some of the elements that you've heard Catherine or Vineta or myself sort of reference around the future of health and how we see this playing out globally, you can actually visit our website as well, Deloitte.com/future. Big landing page, lots of blogs, lots of articles, lots of materials there that you can dive into if you have some curiosity. So with that, Douglas, maybe over to you. And I know there's a Q&A exercise here, and we welcome that. Looking forward to that.
Fantastic, fantastic. And I must say, again, just to support the speakers here, that was a very excellent and insightful presentation and discussion. You did touch a lot of issues that, for me as a clinician, are very close to me. And in the space around innovation, we do need people to engage at all levels in this. It's a multifaceted approach, as you all are describing. So no, I want to salute you on that. It's been a very insightful discussion. Thank you to our guests, Neal, Catherine, Dr. Vineta, for joining me today, and to our media partners at Elemental Television. You can follow the progress on the Medway Innovation Institute via Medway's website, medwayinnovationinstitute.com. Thank you, everybody. Have a great day. Goodbye.